So guys, the National Health Service is 74 years old today. 74 years old. The NHS, as we refer to it, as a national institution, was the envy of the world, and many other countries have nothing like this, and we're very blessed to have it. And it was set up just after the war as an insurance policy. Let's just make this clear. It says that it's not a charity, it's an insurance policy. Everybody pays in. So we've got some sort of a fair system coming out. But as you know, over the years, it has been systematically destroyed. Yeah, it's just been raped and pillaged. It's just through all these PPE contracts, the pills that they give out, all the operations and things. It's just a massive cash cow for people. And a lot of others don't understand is that over 55,000 staff are on over £100,000 a year. So when they are saying, oh yeah, give them a pay rise, it's only 1%, well, that's a lot of money to some of the staff. It should be the nurses and doctors at the lower end of the scale getting this. But we've seen the way they've destroyed it over the years by initially removing the nurses' bursary. So we've become reliant on hard-working foreign staff. Yeah, but what we've got to remember, we're pillaging these people from their own countries, and they're coming over here, probably on a better wage, but still a pittance. Yeah, we should be training our own British nationals and giving them a fair pay on top of that as well. It's not fair on anyone. It's not fair on those countries who desperately need medical staff as well. It's an outrage. The other thing I want to touch upon really is we can't forget about some of the sinister things that's happened with this NHS, and I'm talking about over the last 2 years when we've had Matt Madazalam Hancock going in, and obviously they were putting DNRs on people, and there was probably a lot of murders in hospitals where people who couldn't see their family or anything were just put on Midazolam and killed. This is what's happened. There needs to be a full independent inquiry into this, and we know those poor souls when they went in for something minor, and then apparently got COVID, and then we never saw them again. Very, very sad. They need justice, those people. We've got to start running this NHS if we're going to save it in a more military fashion, because it's been exploited, you know, not mainly, well, a number of reasons, but one of them through mass immigration, because you've got people coming over and you can't blame them for wanting to come over to get free healthcare. They can't believe their luck. But as I said though, it is an insurance policy, and there's too many people taking out and not putting in. It is destined for failure. It is totally unsustainable. It's nothing but a money laundering scheme at the moment, at the expense of people's health. So on this 24th birthday, and it was actually founded in my very town of Swindon in the first place, so it's very poignant to me. I just want to say happy birthday, but if we're going to see you have more birthdays, you need a radical shake-up.